Hey, gorgeous. Welcome to Season 3 of the Hormone Puzzle Podcast. I'm your host, Coach Kayla Smith, CEO of the Hormone Puzzle Society, a women's health hub for fertility, hormones, and pregnancy, an integrative, holistic nutritionist, doctor of natural medicine and training, creator of the Hormone Puzzle Method, an infertility warrior, two-time boy mom, and women's health expert. This podcast is for women struggling with infertility, painful periods, terrible PMS, or really just any symptoms of hormone imbalance that they are ready to eliminate for good. Tune in weekly as we interview amazing experts in the field of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're going to finally help you put those pieces of your hormone puzzle back together so that you can get pregnant and eliminate those pesky symptoms for good. Not to mention, stay pregnant, have a healthy super baby, and easy postpartum. Are you ready? This season is packed with even more expert guests, sharing groundbreaking knowledge, giving you that jolt of energy that you so desperately need, sending you lots of virtual hugs, and inspiring you to take your fertility into your own hands and make that baby. Thank you all so much for tuning in and being amazing listeners. So now let's get started on your road to transformation. On today's episode, we have Jandra Mueller. She is a pelvic health physical therapist at the Pelvic Health and Rehabilitation Center and the clinic director of the Encinitas, California location. In addition to her doctorate in physical therapy, she also has her Master of Science degree in integrative health and nutrition. Jandra utilizes an integrative and holistic approach to find solutions that are individualized to a person's needs and wants. Her focus in clinical practice is on complex pelvic pain conditions, functional GI disorders, as well as hormonal imbalances for both men and women. Because of her own experience dealing with endometriosis, she has a particular interest in this population. She recently co-created an approved 15-hour CEU course for physical therapists in managing complex endometriosis, which was first taught in January of 2021. This show, we're going to talk all about pelvic health and why this is so important for your overall health, but also for your fertility, pregnancy, and postpartum. All of this and more on today's show. Now, let's welcome Jandra to our show. Hey, Jandra, welcome to the show.
Hi, thanks for having me.
I'm excited to talk to you again.
Me too.
Let's dive into it. Tell us a little bit more about you and how you started working in women's health and around pelvic health.
Yeah, I didn't really know that I was going to PT school and eventually ended up there and thought I really wanted to do manual therapy and orthopedics. And one of my rotations, I shadowed a women's health PT or pelvic health PT, and it was really life-changing to kind of understand that there's this whole population of people that don't really get help, and just the improvement in their quality of life was just very rewarding and advocating. And so I really just kind of dived in and did a little bit of women's health and orthopedics for the first few years of PT school, and then really just kept going down further and further to specialize in pelvic health for all genders. And that led me to doing my Master's of Science in Integrative Health and Nutrition to kind of tie in gut health, hormone stuff, diet, lifestyle in this population.
I love that. And it's so interesting. And a lot of people don't think that we need to be worried about our pelvic health, but it's so very important, and for men and women. So I love that we're talking about this. So tell us, what does a pelvic health physical therapist do?
So we do all sorts of things. We see a variety of conditions, and we kind of separate it into high tone disorders versus low tone disorders. And the low tone disorders are things not exclusively, but your urinary incontinence, your fecal incontinence, prolapse. A lot of times it's in the peripartum population or even in the elderly population. And it doesn't mean that everybody's low tone with those disorders, but often you'll see that. That's where things like Kegels are important. But then there's the high tone disorders, which I think that is where it gets really confusing for people to understand that this might be a pelvic floor disorder or pelvic pain, essentially. And so what we do as pelvic health PTs is we do our assessments, and it's not just the muscles in the pelvic floor, which we assess via the vagina or the rectum. And obviously for men, it's the rectum, but females too, both are important depending on the condition. And this is a lot of times where your pelvic pain falls into, is these high tone disorders, or a lot of times outlet constipation, or even urinary frequency and urgency, incomplete emptying. These are some categories that fall into high tone disorders. And we do an assessment. Just like you would go to PT for your knee, you look at, the function of the knee and how you're using it when you're walking. Same thing for the pelvis. We want to make sure you can contract and squeeze, you can bulge, you can relax. Is there something external in your abs or your glutes or your legs that are contributing to making that pelvic floor tight? Is there a weakness? Is there compensation? So we look at all of that, and a lot of us in the pelvic pain world, which is where our specialty really lies, is doing assessments of tissue, especially of the vulva. There's a lot of implications with hormonal changes throughout life, whether it's birth control or hormone replacement therapy, for more like in vitro, like IVF type stuff, or even just as we get into perimenopause and menopause, this can lead to a lot of tissue issues that then compromise the pelvic floor and lead to these symptoms.
Interesting. And so is that what that usually means if we have pain in our pelvis or our pelvic region, that it's a high tone, our high tone is off, and then that's something that we need to see somebody like you to help us fix?
Yeah, it definitely could be. I mean, there's probably outliers too, where it's not necessarily tight and there's something else going on that's causing pain. But yes, if you're having those issues and it's a pelvic floor issue, it's more or less high tone pelvic floor. And I think one misconception, especially in the urinary incontinence group, is I see plenty of women postpartum or young women who are doing CrossFit and like these really intense exercises. Your pelvic floor is part of your core. And so if you're doing lots of high intensity activity and you're having urinary leakage, I think several years ago, CrossFit tried to normalize, there was an article in a magazine, if you're not peeing your pants, you're not working out hard enough. And that's just not true. And wow. So that would be a high tone disorder issue, not a low tone issue for somebody that's dealing with something like that.
Gotcha. And these are things that can be fixed with therapy.
Absolutely. And
amazing.
We do a lot of manual therapy, sort of like a biofeedback where, we're assessing what's going on and we're giving real-time instruction and feedback as to, nope, that's, you're actually pushing out. And then people don't realize like, oh, I thought that was a Kegel. I thought that I was stabilizing, or they're doing opposite things. So, some people use the big machine to look at a screen and see what's going on. And some of us just use our verbal feedback. And then based on what we find, we help to provide some sort of home plan. So that might include exercises, that might include using some topicals or creams. It might include, or just even education around what's going on.
I love that. And so how does vulvodynia play into this? What is that? And how is this something we can also get treatment for?
Absolutely. So vulvodynia is generally just pain in the vulva, and it's really evolved in the diagnosis. It used to just be thought like, oh, I don't know why that's happening. It's just pain in the vulva. And I think the Sex and the City episode where Charlotte comes and says, oh, my vagina's depressed, and she gets put on an antidepressant. While that is actually appropriate, it's not that your vagina is depressed, but there's something that can be treated if it's, a nerve issue. So that diagnosis has developed and come a long way in how we name it. And so now we do know that there can be many causes of vulvodynia. It can be provoked or unprovoked. It can be lifelong. It can be acquired. It can be present throughout the vulva for no known cause. It can be in very specific parts. So one of the main things that I see when it comes to painful sex is something called vestibulodynia, which is a subtype of vulvodynia, meaning pain in your vestibule. So that tissue is actually very hormone driven, and it is right at the entrance of the vagina around the urethra. Kind of, we think about it in a clock. And that is a huge culprit for causing pain, especially if somebody's been on birth control. That can really lead to hormonal changes, even long time after you've come off of the pill. For some women, some of the changes don't come back in the hormones, and they can have these issues. Or lactating women, this is a common time because hormones are low, also into menopause. And so that is something we absolutely treat, and it's almost always tied with some sort of pelvic floor dysfunction or tightness.
Gotcha. And you talk about pelvic floor dysfunction and then pelvic pain. So what is the difference there? Can you go into that a little bit?
Yeah. So when thinking of like high tone disorders versus low tone, I would say pelvic floor dysfunction is generally the system isn't working and coordinating as it should. So you may not have pain with pelvic floor dysfunction. You might have incontinence or constipation issues or prolapse, and that would be pelvic floor dysfunction. But you could also have pelvic pain and also have pelvic floor dysfunction. So I guess I would explain it that just because you don't have pain doesn't mean you don't have pelvic floor dysfunction. And vice versa. You could have simply, a nerve issue in the vestibule, for example, and not necessarily have a dysfunction of your pelvic floor, which is probably unlikely, but you could sort of have one without the other.
Gotcha. And where, you mentioned this earlier, but where do Kegels, or I never know how to say this. Is it Kegels? Is it Kegels? Which one is it?
I say Kegels. Many people say Kegel.
Kind of like tomato.
I don't know how, the man who named that, how he truly pronounced his last name.
Right. But should we be doing these, and how do we know if we need to do them?
That's a great question, and something I like all people to really know it, because what may seem appropriate, like I'm leaking or I feel like I have weakness in these muscles, people, or sexual dysfunction. A lot of times for men, they feel like, oh, I need to delay if they have premature ejaculation, or, their sexual functioning is not where they want it to be or perceive where it should be. And for women as well, especially with orgasm issues, you find a lot of people going online or hearing their friends, oh, just do Kegels. Young women in, again, high intensity exercises or yoga, you hear a lot of times in yoga classes, tighten your pelvic floor. Some people do it more than others, but it can create dysfunction if people don't know how to relax, or they're kind of living with a high tone, like they have a lot of stress. TMJ and pelvic floor tension, there's been a lot of correlation with that. So you may need to do Kegels if you have that, but you really want to understand where your baseline is at. And if you do need to do a Kegel, can you actually return to your baseline and come back from that? With high tone disorders, a lot of times you have this delay in relaxation after that. And so you kind of start already at a high tone, and then you tighten it and tighten it and tighten it. And then there's a functional weakness. So it feels like there's weakness because the muscles can't contract anymore. And so when you release them and you learn that full range of motion, the weakness is kind of not there. You can actually have that strength, but it doesn't feel like that to the person doing it if there is a dysfunction there.
Gotcha. And so would that be something where we would see, like, if we're having some symptoms that we talked about before, we would see a therapist like you, and then you could tell us, like, okay, you're low tone, you're high tone, you should be doing Kegels or not?
Yeah. And some people need both. Some people need to learn how to down train before they start to up train again. And you're really just emphasizing the full range of motion of these muscles. Like, you wouldn't go to the gym and do some bicep curls, but only go to that end range.
Right.
And that's what we're doing with our pelvic floor when we're starting from a higher tone.
Gotcha. Gotcha.
Or compensation. So a lot of times what I see, if somebody's been taught to do them, or they heard, or they've done their own research, they're squeezing their legs, or they're holding their breath, or they're doing something funky with their abs, or they're tightening their glutes. And so you really want to know how to isolate them, and then also bring them back into the system with the core muscles, your abs, and utilize that in a functional way.
Gotcha. I love it. So can you walk us through what happens when we go see a pelvic floor physical therapist? Maybe like our first appointment. What can we expect?
I love this question.
Yeah.
If you haven't been to see a pelvic floor PT, or you found one and you're going to your first appointment, or your doctor says, so many people have no idea what happens. There's fear for sure, especially if there's been some sort of trauma, and it doesn't have to be sexual trauma. It could be trauma from the gynecologist, just kind of, dismissing your pain, or that speculum that goes in. And so they worry, I'm going to have this looked at. We don't use any speculums. We often will try to do a pelvic floor, an internal exam on the first visit, just because that's probably where the source of everything is, or at least we need to understand what's happening. But we use a gloved finger. There's paperwork to fill out, so we know a little bit about your history. We spend some time talking and getting to understand what might be causing it. And then we do our objective exam, again, just like a regular PT would look at your knee, and we look at your movement patterns, maybe your posture, your pelvic alignment, how you're using your abs. And then the internal exam, I always do a vulvar tissue exam first. I hand them a mirror, because there's something empowering, I think, about learning what your baseline is, because where have you learned that in the past? You don't necessarily do that in sex ed. Your parents may have not sat you down and showed you what's what. And many women, and I say this just because I think a lot of people out there probably have this thought, will say, I really didn't know like what was where my clitoris was, or where actually the urethra was. And I think people are shameful about that, but you shouldn't be, because you haven't really been taught. I think it's good to learn that, but if you're coming in not knowing anything, it's not really something to be ashamed about, because you were never taught it. So I spend a good time on that, explaining everything. And then the internal part comes gloved finger, lube, of course, getting you in a comfortable position. There's no stirrups, and just really looking at, first, where is your tone? I always sit, and people are nervous, and I'll have them take a few deep breaths, kind of relax, and I'll cue them if they're tensing their glutes or their abs or holding their breath, kind of cue them to get more into that relaxed state. And then really just go around looking for things that provoke their pain, if it's pain, or why are you having incontinence? Is there a motor control issue? So can you contract? And what happens when you contract? Do you push out thinking you're contracting? Can you coordinate that with your abs? Do you use other muscles? And kind of a teaching experience right there, and teaching them the right ways, and, having them practice that, making sure they can relax, making sure they can bulge. And how I say is, you need contraction for support for your organs. You need it for holding in pee and poop, and also sexual appreciation. You need to come back from that to not develop that high tone, and you need to bulge correctly to have bowel movements in babies.
I love that. And so is this something where it's kind of like we go to our gynecologist to get yearly well women? Should we think about coming to a PT even if we're not having symptoms, just to make sure that we don't develop symptoms down the road?
I mean, I'm going to be biased and say I think that that's a great thing to do. I mean, I think it's hard to kind of say, well, I'm not having any problems. You may not be aware that those are problems. But I think it's good. And actually in the past year, really, I've seen a lot of that happening, especially in the peripartum population, which is amazing. You don't know your baseline until you have problems. So we don't know for years and years and years, like what's been building up, maybe you were in gymnastics and you played soccer, and then you went to college and you started doing CrossFit. And there's all these things that could have been risk factors to predispose for something. Or we normalize symptoms. Oh, I just have a small bladder. No, nobody has a small bladder. But it might not be functioning correctly because there's behaviors we've adopted.
For sure. I'm just thinking about for myself. I'm like, I'm not having any of these issues, but I don't know if I have high tone or low tone or if it's normal. So I was just thinking what a great thing to do. And would this also be for somebody that, maybe I have a lot of clients that'll say like I have recurrent UTIs. That's definitely a PT issue, a pelvic issue.
At least to get that part ruled out, because if you had a true UTI, probably the first time you've got it checked, and yeah, it probably was a UTI. But when you're starting to have recurrence, I would really question if it's a true UTI, especially if you've been on birth control or you've used something maybe like Monistat to treat a yeast infection, because that can cause irritation to that tissue I mentioned, and that tissue is derived of bladder. And so one good thing, if anybody out there is listening, to think about is if you're having these recurrent UTIs or UTI-like symptoms, urgency, frequency, a little bit of pain, you go, not a lot comes out, and you kind of put where you feel like it is, and it's right near kind of where your clitoris is, that might be your urethral issues, not so much a bladder infection. But that could be from that tissue because of XYZ, or you have a new partner and you feel like you get a UTI every time and have to take antibiotics. There's potential reasons for that. The tissue could be a little bit hormone deplete, or you could have pelvic floor dysfunction, meaning high tone in those muscles, which can create that even without a disruption in that tissue. Or you may have a dysbiosis going on because you've taken antibiotics throughout your life for everything here and there, or for 5 years since you've been sexually active, you've had to take an antibiotic frequently because of this. So what I tell all my patients is that antibiotics are necessary when there's an infection, but you want to make sure you actually get that cultured. So you don't go into the gynecologist, they dip it, they say, oh yeah, there's, elevated white blood cells, you have a UTI, here's your antibiotics, you start taking them, and then 3 days later they call you and say, oh, the culture is negative. That's inflammation. And that can be derived from all of those things that I just mentioned. And ultimately, you want to protect your biome in your vagina, in your gut. And every time you take those antibiotics, you sort of shift your biome in the wrong direction, ultimately potentially making the problem worse.
Gotcha. Yeah. I have a client that every time her and her husband have sex, she gets a UTI, and I'm like, this is not normal. There's something going on there. So I recommended that she see a pelvic floor physical therapist. So I'm so glad you mentioned that.
Yeah. And it may not be a pelvic floor issue, but at least some, if we do the vulvar screen, we take your history, you've been on certain medications that can predispose this, we test that tissue, we at least probably have the resources to go to the right people instead of just having nowhere to go, or saying, oh, sorry, you're, or doing PT just on the muscles, and then you're maybe having some improvement, but you're still having this issue. It's an interdisciplinary type of care.
Gotcha.
Yeah.
So we're going to take a short break to hear a word from our sponsors. We're going to come back and talk practical tips on how we can start to optimize our bodies for, our physical and mental bodies. So we'll be back. Hey y'all, it's Coach Kayla here. I hope you are loving this episode as much as I am. We will be back in just a minute, but first, a word from our sponsors. Hey ladies, I am so excited to invite you to our upcoming summit, the Solving Infertility Summit. Learn from over 50 amazing women's health experts, life-changing solutions to help you solve your infertility puzzles and optimize your natural fertility so you can finally get pregnant, stay pregnant, have a healthy super baby, and an easy postpartum. Don't delay, register today. We go live January 17th. Also check out our VIP package for more access and amazing gifts. I cannot wait to see all of you there. Hey, Jandra, welcome back.
Hi.
So let's talk practical tips. What are some things that we can do maybe? And we talked about this a little in the beginning, but maybe get a few more tips on what we can start doing to, improve our pelvic floor at home. Is there any little quick exercises maybe we could do?
Yeah, I would hesitate on the Kegel part.
Right.
You see a PT to make sure you're doing it right. But considering urinary frequency, urgency, by the way, normal urination is about 5 to 8 times per day. You should be able to hold your bladder for about 3 hours. And so if you're going more than that, you may want to try and just do some nice diaphragmatic breathing relaxation exercises. And not just for that, but if you're having pain or you're having constipation issues, doing some deep breathing is a very safe exercise. It's not going to harm anyone, even if you have a low tone disorder, and kind of just get in tune with, are you tensing or clenching throughout the day? And do you now feel in a relaxed state? Or if you have a stressful job or a time of life, essentially, or COVID, or you notice you're clenching your jaw, these are some signs that the pelvic floor may be also really tensing. So trying to do some almost quick body scan check-ins throughout the day to see, are you holding tension? Are you squeezing? Can you feel your abs activate, or do you feel like you're bulging out when you're exercising? These are some things to kind of look for to see if you're having maybe some tension in your pelvic floor.
I love that. And is there any foods that we need to be thinking about? Like, what can we be eating to maybe optimize our gut? And then also on this, how does gut tie into our pelvic floor and our overall, health of our vaginas?
Yeah, I would say in general is quite specific to the person and the condition going on. But assuming there's no GI issues going on, eating whole foods, eating things with good healthy fats, fish, nuts, seeds, kind of like Mediterranean diet, essentially, whole foods, veggies, fruits, limiting your processed foods, or having, a lot of junk per se, or having little fruits and vegetables, less than 5 to 7 servings a day, drinking enough water, approximately half body weight in water or half your body weight in ounces is appropriate for most people. And I would say if you can, and you're not having symptoms, doing something like probiotic rich food, so kefir or sauerkraut, kimchi, fermented veggies, these are all really good foods to help your biome. Now, if there's GI issues going on, sometimes those foods don't feel good to people. And that's a sign that you should, that's something else. You should be working with like a nutritionist or a GI to kind of rule out what might be going on there. But that's going to be really good to keep our general biome very healthy.
I love that. And what about cleaning our vagina? Should we be using like douches or sprays? Like, how do we keep it clean down there?
Yes. So the vulva, including the vagina, is really kind of, self-cleaning. And I think that our multitude of products that have scents in them is very prevalent, because I think that there's a message to women that something is wrong with our smell, even if it's normal, and we try to hide that, and that's just not true. And so you can wash, the mons, which is where the hair is on your pubic bone. You can, of course, wash that with a gentle soap or, non-harmful chemicals, but really like water. Just, you don't need to put anything inside. If there's a smell or an odor or odd discharge, that's a sign that you need to get that checked out. Sometimes it can be tricky, and your regular gynecologist won't check for everything. And so you may feel everything is okay, but I would keep advocating for yourself for looking. There's integrative gynecologists that will do different types of swabs to look at the biome, because you could have a dysbiosis, so an imbalance, but not necessarily an infection. And that's where BV comes into play, bacterial vaginosis. And so, a lot of people don't like that smell, and so they want to hide it. So they use different products or creams, or people will do douching after sex. And so all of that, it's not necessary to do. And it can be harmful, especially things like monostat. It can contribute to a particular type of vestibulodynia that may be pretty serious. And so talking to your doctor if you have a yeast infection and trying something other than an over-the-counter monostat would be ideal. Yeah.
I love that. And I know that this is probably a loaded question, but tampons, pads, like, what should we be doing there?
That, again, I would say is like person dependent. I would say that trying to stay free of those heavy chemical ones with all the scents is a good idea, sticking to organic. But I do know that there are some studies that even talk about organic products, because that can mean a lot of things, right? Can even still cause irritation in the vagina. I would say I see a lot of people who have used tampons their whole life, organic tampons, things like that, and have been fine. But if you are having some issues or they're uncomfortable, they shouldn't be uncomfortable. So that's, again, there might be some dryness or irritation in that tissue that's causing you to feel like when you, maybe not when you put the tampon in, but when you take it out, kind of is dry and feels sandpapery. That may be an issue with your tissue, not that you can't use tampons. A lot of people have been really liking the different, like the cups now, and it's great. You know, they're reusable. You can wash them. I think that they're great if you're somebody who likes using that and they work for you. I would say one note, which is not super intuitive, is when you take it out, you have to kind of release the pressure and fold it in, and then it comes out. I haven't seen this, but the one thing I do worry about is tugging on it without doing that. Is that going to sort of pull the uterus down and create some sort of laxity there? I haven't seen that, but it is something I would be concerned about. And then there's a lot of like period underwear now too, as well, that, you know, you can wash and it's reusable. And there's reusable discs also, but there's also the disposable discs now. So there's a lot of options out there for women of what your preference is. Just, you should choose your preference, not have, I can't do this, so I'm going to choose this because there's probably something wrong.
Gotcha. I love that. And I love the period panties. They're so like helpful. I haven't used tampons in years and I love it. So, but it is definitely personal preference, you know, find what works for you and that's the best choice for you. But yeah, I love that you said, you know, don't do it because you can't do something else, because then that might be an issue going on.
Right.
Cool.
Always have the choice.
Yes. So tell everybody where they can find you and learn more about working with you.
You can find us. Our company is the Pelvic Health and Rehabilitation Center. So we have 9 going on 10 locations now, a couple on the East Coast, and then the rest mostly through California and the Bay Area, and I'm in San Diego. So we offer in-person appointments, but we also do digital health sessions. So if you're elsewhere in the country, you're not getting the results, we are always open for doing a digital health consultation. We can provide resources or help you find the people in your area if you're dealing with some pelvic pain or these recurrent UTIs. And then additionally, I offer digital health sessions for integrative health and nutrition. So that's open to most people in the U.S., depending on the state you're in. But the majority of the states, I can see people, and it's all done online. And our website, there's a book now. You can email us through there or request an appointment, and somebody gets back to you wherever you're located.
And I love that.
Yeah. And our Instagram, where we share a lot of things, is @pelvichealth. We also have a blog and our newsletter that comes out every week, just talking about all things pelvic health. So it's a great place to educate yourself as well in the information provided there.
I love it. And we'll have all that linked under the show, so it'll be real easy to find. Well, Jandra, it's so fun talking to you always. Thank you for being here. I would love to just end with maybe a final thought or, a piece of advice or a piece of wisdom you want to leave us with.
Sure. And yeah, it has been great coming on here and providing education. I think ultimately, especially if you're in rural places or places where there's not a lot of providers, or you're stuck in a Kaiser situation or an HMO and you're having difficulty, keep advocating for yourself and really try to find information. There is lots of good information online. Sometimes it's hard to weed through and know what's good and what's not good, but you know your bodies. And if you sense that something is wrong or isn't quite right, I would trust that and keep looking.
For sure. I love it. Well, thanks again. It's so fun to talk to you. I really appreciate it.
Yes. Thank you so much.
And thank you, ladies, for listening to the Hormone P.U.Z.Z.L.E Podcast. Until next time. Bye.
Bye.
Wait, before you go, don't forget about our VIP package. Want access to all the speaker interviews, watch at your leisure and in your own time from the comfort of your own home. Also, come back and reference any episode at any time as your needs change and as you move through your journey. For one low price, you get all the summit recordings, unlimited access, our swag bag filled with so many different freebies from all of our experts and sponsors, as well as discounts on all of our services, plus a copy of my book, The Hormone Puzzle Method, Solving Infertility. All this and more for one low price to help you finally solve your infertility puzzle so you can get pregnant and stay pregnant. But don't delay, because this deal won't last long. Once the summit starts, it's gone forever. So to take advantage of this deal and lock in your savings, visit www.solving-infertility.com/purchase. Hey, hang on just 1 second before you go. I want to make sure that you are aware of all of the amazing free resources that I have for you on my website at CoachKayla.com. From a fertility meal plan, a cycle syncing quick start guide, a holistic healing cookbook, as well as master classes, blog posts by me and some amazing experts in the fields of fertility, hormones, and nutrition. So many wonderful resources that will help you on your journey. And I wish there had been something like this when I was going through my 2 years of infertility, but there just wasn't. And so that's why I decided to create all of this for you. So make sure that you go and check it out and you take advantage of this plethora of support that I have provided for you. And spoiler alert, these were some of the same tricks and the same foods that I used to get myself pregnant, not once, but twice, even after my doctors said that I couldn't. So I know that these things work. So make sure you take advantage of that. And I cannot wait for you to be my next success story. So thanks, love. See you soon. Thanks for tuning in today to the Hormone Puzzle Podcast. Check out the show notes for today's episode at CoachKayla.com. If you like what you hear, please subscribe and leave a review. Thanks for hanging out with me, and I'll see you next week.